Hey everyone, I want to give you a brief about somatic symptom and related disorder. Let's watch and let's learn. So we have several types. We have the somatic symptom disorder, illness, anxiety disorder, conversion disorder, and factitious disorder, and malingering. So I'm going to give you some quick details about each of these disorders. Somatic symptom disorder involves a long-standing pattern of physical complaints without any identifiable medical cause. So a person can come in, I have a headache, I have gastrointestinal pain, I have back pain, I have leg pain, I have dizziness, like several physical complaints. But when you do tests, there is no identifiable medical reason for those symptoms. Okay, so that's somatic symptom disorder. So illness anxiety disorder is a condition where individuals have this intense fear of having or developing a serious illness, even when they don't have any physical symptoms correlating with that illness. So this is also and previously called hypochondriasis. So when you see people and say, oh, you're a hypochondriac, they believe intensely and they have that fear, they have the serious illness. For example, they might say, oh, I have hypertension because I'm having a headache, slight headache. Or even if there's no physical symptom, they believe they have an illness or a serious disease. So that's illness anxiety disorder. Conversion disorder is the presence of any neurological symptom, which could be motor symptom or sensory symptom, that are present and not consistent with any known medical condition. And this happens due to psychological factors. So, for example, you hear of an accident and all of a sudden you have a seizure, or you become blind, or your legs can't move anymore, you can't walk. Those are neurological symptoms. There is no known medical condition for those symptoms, but you have those symptoms, and it's always due to a psychological factor. That is conversion disorder. Factitious disorder is the intentional production of symptoms. It could be physical, it could be psychological, just to assume the role of being sick, right? So people with factitious disorder, they usually fabricate their symptoms or they exaggerate their symptoms just so that they can receive medical attention or get attention basically, or receive medical care. So they feign their sickness or their symptoms just to get attention. That is factitious disorder. Now we have malingering. Malingering is the intentional exaggeration of physical, psychological symptoms for external gain or incentives. So while factitious disorder is for attention and medical treatment, malingering is for external gain. Such like maybe to avoid going to work, you say you're sick, or to get disability, you feign that you can't walk or something like that. So that is malingering. Let me know if you have any questions about the somatic symptoms and associated disorders, and we can talk more about it. Take care now. Bye-bye.